With the Omicron coronavirus variant circulating, Colombia has seen a sharp rise in confirmed COVID-19 cases in the new year. Health officials reported more than 29,000 new cases on Wednesday,
La positividad en Bogotá.
but say intensive care unit occupancy is not as high as during previous peaks. This is in line with a general health consensus that the Omicron variant may not be as lethal, but is much more contagious than previous COVID-19 mutations. On the streets of Bogota, citizens say they feel an overall sense that most people are trying to live their lives as usual.
I think that partly the problem is people that are not getting vaccinated and they are dropping their guard, and that some of the government's measures are permissive.
I see a lack of discipline by citizens in the country because they aren't doing their part.
There are many places where there are not enough vaccines. People go to get vaccinated for a second or third dose, but we don't have them.
Colombia has received all of its purchased vaccines to date, though some cities are reporting shortages in supply. This as the country is falling short of its vaccination goals, with just 58% of Colombians now fully inoculated. While citizens try to get their hands on available doses, the government has announced a new measure requiring workers who regularly interact with the public to be fully vaccinated. It covers employees in such places as bars, restaurants, museums, and theme parks. Meanwhile, Colombia's health ministry has adopted a reduced isolation period for people likely infected with the Omicron variant, and says otherwise healthy younger people need not bother to test at all.
Esas personas que han tenido esa sintomatología.
At the start of symptoms, they should begin isolation for 7 days, not 10 or 14 days, just 7. And it's not necessary that they do a test, as it's possible they have the Omicron variant.
The new normal for Colombians trying to get a start in 2022. Begue, CGTN, Bogota, Colombia.